The Federal Ministry of Health and its implementing partners for the National Malaria Elimination Initiative are calling for increased investment in malaria programs. This is with an aim to achieving full coverage of malaria services that ensures everyone has access to malaria preventive and treatment services. Minister of Health Osage Ohanire spoke at a press briefing on Tuesday in Abuja to commemorate this year's World Malaria Day.
The World Malaria Day is commemorated annually to highlight the progress made in the fight to reduce the burden and the public health challenge. Government officials and private sector players are having this road walk to sensitize the public on the need for malaria elimination. They are making a strong case for how increased investments in malaria programs would rapidly drive down the surging cases and deaths in Nigeria.
Malaria elimination is clearly a cost-intensive exercise. And with dwindling external support, we have had to develop a plan to scale up the public-private philanthropic partnership for domestic resource mobilization to ensure increased funding support for malaria elimination.
The World Health Organization is, however, seeking improved innovations. The organization is also hinting on the shortage of malaria vaccines for children between the ages of 6 months to 5 years.
The landmark recommendations on the use of the first ever malaria vaccine, RTSS, were released by WHO late last year. This vaccine will be used to prevent malaria among children aged 6 months to 5 years who live in moderate to high transmission settings. While this is a groundbreaking advancement in the development of new tools to fight the disease, with the potential to save millions of lives, supplies are currently limited.
The private sector have a role to play. They are working to ensure competency of health workers in attending to malaria cases.
We have found out that many people will go for alternative treatment because they are afraid of the kind of attention or the kind of reception they will get when they go to health facilities. So we are also working with the healthcare provider to be able to treat people nicely and also to abide by the national guideline. The NMEP has a national guideline for the treatment of malaria. So,
while the federal government and its implementing partners of the malaria elimination program continue to play their part, they want communities and localities to take ownership of preventing malaria by accessing proper health care in order to achieve a malaria-free Nigeria. Favor Basir to Silverbird News 24.